Okay, we're recording.
Hello, folks. This is Seven Song coming to you from Ithaca, New York. Today is a beautiful autumnal day. It's mid-October. Well, it's mid-October everywhere, but today's just gorgeous in the 70s. So I'm not sure why I'm saying that, but I feel like a nice way to start talking about tonight's subject. So tonight I'm going to is part 2 of practicing as an herbalist in a free clinic. I've already given one class about this. If you're interested in seeing that class, you can go to YouTube and type in Seven Song with the number 7 Herbalist, and then you'll see just all the videos that I've been putting up, thanks to the help of Miss Michelle Marlowe, who's been incredibly helpful for me throughout this, me learning my technical chops. Also, I'll be looking a lot to the left. That's where my notes are. So that way I don't get way out of line speaking, which is my tendency anyway, so keep some organization. Let me tell you a little bit about what was in the first class. So that won't be covered in this class. There might be a third. I'm not sure. We'll see how far I get today. I have a lot of notes. Often I'm not really ever sure how far I'm going to get into them. So in that class, that class was my personal experience in helping being one of many founders of the Ithaca Free Clinic, and a lot of the early days of setting up the Ithaca Free Clinic, which has been open since 2006, and we started meeting around 2004, 2005. In the previous class, I talked about my goals. I talked about working with other healthcare practitioners, legalities, a little bit about patient education. There'll be some repetition from this class and that class. But that one has a little bit more of the philosophical aspects of working in a clinic, and what I would like, what my fantasy-free clinic would look like, and just a lot of the hands-on setting up that went in. I've been working there since 2006, and it's been, you'll hear me, I'm very clinic proud. It's one of the things I've been a part of as an herbalist, not as a human being, but definitely as an herbalist human being. That's been profound in my life, teaching me skills in many, many different areas, and also treating people for free. So a very quick overview is the Ithaca Free Clinic is an integrative free clinic. We have many modalities, both what I call conventional, so medical doctors, nurse practitioners, nurses, and then also on the less conventional or the holistic, there's really no good word to describe it. The other folks, often not Western University trained, and so there's both conventional, less conventional, or different medicine, but everything is free. So all consultations are free, and then all the herbal medicine is free as well. And so I'll talk a little bit about donations this time, but I also talked about it previously. All right, so I'm going to just move right into it. So what I want to do is stay a little bit, the first half hour, maybe a little more, we'll still be kind of in the philosophical end. And then today I'm hoping to move way more into the herbs and some of the treatments that we do. As I wrote, it's not going to be about specific treatment. This is not a class on treating respiratory ailments. This is not a class on learning the intricacies of echinacea. There's a class on free clinics, but I want to cover some of the more common health issues that we see there and some of the ways that we work with them. As I've talked about in every class, a lot of working with people is dialogue, is communication. And one of the things that herbalists can do, all of us, you don't have to be an herbalist, of course, is to offer agency, which means giving people information to help them make choices, because often the information is scarce and not readily available. So what I want to do is I want to start off by talking about what we look for as an herbalist. So this is, I'm going to say this because I think these are some of the words that I think are important for an herbalist working in a free clinic. This is not an advertisement for more herbalists in the free clinic, in the Ithaca Free Clinic. If that's an interest, you can talk with me about it. We have 2 right now, and that's usually enough to cover our bases. So this is just a list of some of the things that would be helpful for an herbalist. So if, let's say you live in Cleveland and you want to work with one of the local Cleveland clinics, and I would say these are terms that they might be looking for from an herbalist. So it, it has a lot of conventionalness to it, hence the button-down shirt, which also I just like wearing button-down shirts. So they're in alphabetical order. Oh, so throughout my classes, pretty much everything's in alphabetical order and rarely in order of importance. It just makes it easier for me, so I don't have to sort out what is more important than others. So here we go. So these are some of the ideals or ideas. So working at a free clinic, clinical experience. This is actually one of the hardest things for herbalists to get. There's not a lot of avenues for herbalists to get clinical experience. I run an apprenticeship, and a few other herbalists do, but I would say it's one of the more difficult things for herbalists is who are you going to work with and learn these skills. I'll talk a little bit about it later. Competence. So competence doesn't mean knowing everything. Competence means having humility to know what you know and having humility to know what you don't know and reaching out when you need help. Counseling skills, extremely important. You can learn counseling skills though in any professional art, and professional not really a necessary word. Anytime people dialogue, like nonviolent communication, just accessible communication, just learning to be a good listener. So communication skills and counseling skills, I'll put those two together, are paramount in being a practitioner, healthcare practitioner. For us, so I would say any place, dedication to the clinic is also very important, right? So if somebody's looking at coming into the clinic, I want to make sure that you're going to stay there for a while, a year or 2 years. We're not looking to train people. And I think every clinic is like that. When you're there, you want somebody who you feel like is, after their training and after they're involved and integrated into it, that they're not just going to leave again. I would say other things that are important for us working in clinics would be dedication to furthering our education. Integrity, that's a very big word, means many different things. I would say a lack of dogma, especially for herbalists, maybe for everybody, but herbalists often can carry a lot of dogma and medical people are looking for that. I'm not saying medical people are without their dogma, but I would say herbalists, the clinics that I work in, the Ithaca Free Clinic and other places, is heavily medicalized. And so if I'm just going to hold on to like herbs are the only way, that's certainly not going to get me anywhere. So I think that's true in most avenues of life, but having a relaxed dogma and listening to other people and learning. So then there's proficiency using herbs. That comes more with time. Understanding pathophysiology and physiology. I think both of those are paramount as well. I think understanding pathophysiology is disease in the body and how it affects the organs and systems in you. Physiology is just how things function. Anatomy is the stuff. Physiology is how the stuff works. Understanding how that stuff works, how your heartbeat, how blood moves through your body, how blood vessels interact with the nervous system, how circulation interacts with the rest of your body, very important. And then one or two more, willing to learn from our mistakes, because they're going to happen, right? I mean, they happen in every other field, and every other avenue of life. They're going to happen here too. And so, it's not a matter of apologizing and over apologizing. It's a matter of learning and moving forward. And then we're willing to work with others. So that's it for that. I'd like to spend a minute or two about where herbalists can try to acquire skills. This is one of the hardest things to do. So first, I would say you don't have to acquire herbalist skills. I would say you need healthcare professionals should learn counseling skills, and it could be a chiropractor, a medical doctor, a nurse practitioner, a massage therapist, anybody who does more involved intake and has good, what's often called bedside manner, often like a good relationship and good communication skills. You can learn this from a wide variety of health professionals. If there's an herbalist that will take you under their wing, that's even better. But you can also, I'm saying that's often hard to find. So just reach out to other places. A good friend of mine in Oregon started getting her skills working with a medical doctor and managing a small apothecary and building it up from there. But the medical doctor was very into herbal medicine, so it made it much easier. Hello, Oregon. So of course, there are schools and education programs. I run a school, the Northeast School of Botanical Medicine, but my school is just 1 year. It's very clinical oriented, but some other herb schools are 3-year programs, and the third year is really focused on learning clinical skills and having teachers help you as you see patients or clients and learning there. So other herb schools and programs. And I think those are, also like finding other health collectives that are around you that like less mainstream health collectives. And often there are many of them. Many of them came into being with COVID. Many of them came into being after the terrible fires of the Northwest. And sometimes you can join a health collective, maybe meet people there. Again, just be honest with your skill level. You don't, instead of trying to pretend you're something you're not, you say, these are my skills. I'm willing to listen and I'm willing to do grunt work, right? Because with all these things, we all do grunt work. There's all basic moving stuff around, computer work, there's all the basic, all this that's not about treating people. Now, so I'm going to keep going. The next, what I'd like to talk about is how about funding herb clinics, and just some questions that you can think about if you're going to do this. So this is about funding and donations, because if you're going to work in a free clinic, where are you going to get the goods, right? Where are you going to get the herbs? Where are you going to get the alcohol? Who's going to make the medicine? Where are you going to store the medicines? Those are real questions. As I've talked about previously, I basically underwrite the giving away herbal medicine for the free clinic. It can tally up to quite a bit, but I run an herb school, and my herb school helps support this, and it's something I want to do, and I feel incredibly honored to be there. There's no unwillingness on my part. I can afford this. I can do this, and also I do get donations. Excuse me again, from numerous sources. But a lot of the medicines we make, when we get donations, often they're dried herbs, and then I buy alcohol, and then we make the medicines or oils, and then we make them here in my home. So these are just some questions to consider. How will you fund your services? How will you fund your medicines in the clinic? What type of medicines are you looking for? Are you looking for, or really, excuse me, what type of donations are you looking for? Are you looking for medicines? Are you looking for equipment? Like right now, I'm looking for somebody, I think I found them, to help me build shelving. We need better shelving. I'll talk about equipment later. And then, herbs, and then of course, money. Money comes in very handy for this. So when you're thinking about it, what kind of donations, who you're going to reach out to, has a lot to do with what you're looking for in return, or what you would like as a donation. If you're doing this and working with other people, who will be who's going to reach out and do donations? Everybody can, but frankly, it gets complicated if lots of people are doing the same job, because some herb company might be getting 4 or 5 letters from different people in the same organization, and I think it just looks nicer or better, easier if one person takes it on, or at least organizes it very well. And then who will keep track and hold on to the donations, right? So the medicines come in, and now where do you keep them? The money comes in, and how does somebody stay accountable for the money coming in? So that there's the accountability and the storage and organizing of donations when they come in. What sources do you already have? So for me, one thing that was easier is that I've been in the herb world, meaning around Herbalist and herb companies since the early 80s. And so I had a lot of networks in hand. Some of you won't have those, but you can develop them. Ask around, find out where other people get donations. But who do you know already? For instance, you might know some organic farmers, and you can say, would you mind next year growing me, 5 marshmallow plants, or a bunch of lemon balm, and then even suggesting that maybe they can grow it and you can gather it, or somebody else can gather it. So in other words, you might already know some of the networks in order to get herbs. And then money as well. There might be people around you who would really like to help out and don't have herbal skills, but might have money that they would like to put in. So I think, asking is reasonable for these things. It's not I have to say though, it is not my favorite part. I'm definitely one of those people who waits a long time before asking for donations, unless even when I know the person, frankly, well. It's just, I don't know. It's just something built in. But I push past it. And really, a lot of the people that give donations are really like to give the donations. And Often, their herbs might be coming expired soon. It might be something that I can use. So again, reaching out. So those are some ideas for looking for donations. These are a little bit out of order, but I'm going to take these as I have them written so I don't have to go back and forth. So one thing I want to talk about, so this is really pushing things ahead. I apologize, but we'll come back to kind of this more philosophical. But I'd just like to talk about some of the reasons for low compliance with people taking herbal medicines to consider this. So again, this is out of order, but I'm going to go forward with it. So what I'm talking about now is one of the problems we have as herbalists is people being not that interested or not too excited about taking herbal medicine. They have good reason for it, right? It's new to them. So again, as I've said many times about in the free clinic, about 80%. So I only work 4 hours a week in the free clinic, just to give a scope of. So I've seen many people over many years. That's about it. But about 80% of those people have never used herbal medicine. So for me, this is like a very much real question. Patient compliance, the desire, the ability for people to actually take the medicine, to me, is just very real. If people come in and they are former students of mine, or they clearly have taken herbs, it's much easier. But I would like to reach people that have not previously taken herbs. It's definitely one of my agenda. I mean, I have a couple. I like to make herbs accessible to people who don't have the resources, financial or other resources, people who are often left on the fringes of society who don't have access. I mean, these are very important to me, which is why a free clinic is something that I'm so glad to be a part of. So I'm going to talk about some of the reasons for low patient compliance. That's the term for it. So they're often confused on how to take the medicine. Our medicines are often odd. I mean, they're liquids. They come in, they look like this. When was the last time you went to a pharmacist? You went to Rite Aid, and they gave you a bottle that looked like this, especially with kind of a homegrown label there, right? The answer is pretty uncommon. But even just like external preparations like oils. And so I'll talk about making brochures for people, but right now I just want to say, here's what I'd like to put it in. Just think about what it's like. Like this is one of those thought illustrations, whatever they're called, mind exercises. Think about what the average person uses for medicine, right? So in your mind, they go to a doctor. The doctor has a kind of an office and asks kind of the same kinds of questions that you would expect. That's a little different when you see the herbalist often. And then they get a piece of paper, a prescription, and then they bring the prescription to a pharmacy. The pharmacist looks at the prescription and gives them some pills. Those pills are really pretty small. They're tasteless if you don't chew them. The person swallows them, and that's it. Now think about what happened. Like I'm there and I'm saying, well, I would like you to take one dropper full, and the droppers, right, are inconsistent, right? Even there, it's like weird, like just very different. Like what is a dropper full? We'll get more to that later. So what I want you to do when you work with people is think, what is this person used to? This person is used to getting a small, I don't have one here, a small bottle, those brownish bottles with pills and a label. The labels have gotten much better. They used to be hard to read. Now they're much easier to read. And then I'm giving them something different. How do I make this comfortable for them? All right. So number one is confused how to prepare the medicine. What we do in the clinic is we just explain it until we can recognize that the person understands what to do, and then we take it from there. We go over it as often as we need to within the allotted amount of time. So the herbalist cup, known as a jar. Next. So I'm going to read through these. So we have a certain amount of time. I'm going to stop at 8 o'clock Eastern time and get through this. So they can be confused about the dosage, how much to take. Again, clarity is important here. On the label, your labels should have the dosage. This one actually doesn't have the dosage, but the dosage should be very clear on your labels. We'll talk more about labels in a bit. The flavor, man, these things taste terrible, right? I mean, really, most herbal medicines, they just have flavor. Like it or not, they have flavor. Plants have flavor. It's very hard to disguise it. The easiest way to disguise flavor in plants are capsules. Every other form pretty much has lots of flavor. Teas, tinctures, glycerites, even though they're sweet, lots of flavor. Whereas you think about pills, capsules, often with very little flavor. So you can try to alter the flavor. Sometimes, though, if you try to alter the flavor too much, you reduce the potency of the medicine. They have to take more, and that can reduce compliance. Kind of a negative feedback loop there. So about teas, they might not have the time to prepare a tea, and it's just difficult to carry teas around. We do use them in the clinic, but frankly, the people who use tea are often herbal people who drink. Let's try again. Are people who already use herbal medicine and drink tea, and often people who come from other parts of the world where tea drinking is a normal part of their culture, and then it's very easy. But for many other people, tea is difficult to make, difficult to clean up, and I do mean that. I mean difficult. I mean, like, it seems simple, but if you have a lot going on in your life, you're adding complexity, and complexity increases anxiety. So tea can be more complex, but also just having people take their medicines. For instance, if you have working with a person who's going to school and they're going, let's say they're young and going to like a public school, often they can't take their medicine with them, or you have to talk to the nurse, and the nurse may or may not be open to them taking it. So just how they take the medicine throughout the day. And the thing about tea, of course, it just takes up a lot of room. Like you basically have something like this to carry around. It doesn't have to be glass. They might not feel the herbs are helping. This is common. Herbal medicine takes longer for its effects to come on often than drugs. So many drugs, it takes a long time as well. But you're working on somebody's nervous system and you don't want sedation, and you're giving something like Damiana, Tulsi, Rose, Passion Flower. Sometimes the person may never really feel effect because it comes on nice and subtly. So you ask in 2 months, how do you feel? And the person's like, oh, about the same. And then you ask, do you feel as anxious? They go, oh, I feel a little less anxious. So maybe it's the herbs, right? So in other words, not all herbs are subtle. We'll talk about some less subtle herbs as we go into this. But often you just, you're trying to help regulate somebody's menstrual cycle. And often the herbs take at least 2 months. I mean, a lot of the herbs take that long to get, you have the person moving 1 or 2 cycles in, and then the herb taking effect. So often people don't think the herbs are helping. So as their symptoms lessen, this is true of medical establishment and conventional medicine too. But as their symptoms lessen, you may cut down on an herb or lessen the dosage or the amount, when actually it's important for them to maintain the same amount for a longer period of time to have a bigger impact on tonifying or actually altering the function of that system or organ. Their interest may wane. I think this is probably one of the biggest things that I work with, is that I'm working with people and, I think they start taking it and it's interesting and it just seems like a lot to do. Their interest wanes. If they're buying them, they become, herbal medicine is very expensive. So, and there's no insurance that covers it. So like, of course, modern medicine, pharmaceuticals could be very expensive, could be crazy expensive. Whew. So, but sometimes those things are covered by insurance or by governmental assistance, whereas herbal medicine basically is out of everybody's pocket. And sometimes you need a lot of it and regularly for it to function. And they just may not have access. They live someplace in the many areas that doesn't have access to herbal medicine. So that's it about low compliance. What I want to move towards right now is about patient education and some of the ways that I think that's important. So I just want to cover some things briefly. A lot of this was discussed in the last class, but I wanted to refine some of these points. So I tend to be over-education-y. I tend to overly teacherly. I talk a lot. And so it's important to not overteach, not overeducate. Like, not everybody's coming to see an herbalist to learn about herbs. Many of them just have a healthcare problem. They would like herbs for the healthcare problem, and not all of the dialogue about their healthcare problem. So for someone like myself who wants to describe things, first, it just takes up a lot of time. But here's an important thing. If you're talking, you're not listening, right? Again, if you're talking, you're not listening. So most of the time there should be spent listening as well. That said, many of the people who come to see me are interested in both their conventional healthcare protocols, like the drugs they're taking, surgeries. I'm by far no expert, but I can listen to their fears. I can discuss some of the options if I understand some of them, because most of my patients are on medications and I have learned about many of them. But I want to say this very clearly. My job, according to me, is not to get people off their drugs. That is not my job. If people want to discuss that, that's entirely in their realm. We can discuss it and see what the probability of that is. But my job is to give herbs. I'm not trying to make people herbal. I don't know. I'm not trying to alter the way that they interact with the medical community and the drugs that they take. Next, on educating, sometimes when we ask questions, we can describe why we're asking those questions. So somebody has a headache and I ask them about bowel movements. I could say, that's just weird, right? They might not be used to that at all. They've had headaches, they've been going to neurologists and doctors, and now they come and see an herbalist. And all of a sudden you're saying, are you constipated frequently? Do you have a lot of gas? Because digestive problems can cause headaches. I mean, the medical world knows some of this, depends who you see. And so I think, trying to say, this is why I'm asking this question, because it gives the person agency. Once again, agency is the person's understanding of themselves better in order to make more qualified decisions about themselves, right? In all fields. So we're talking about the health field right now. And so saying, somebody has a lot of pain in their arms and asking them if they have pain elsewhere in their body, or just trying to find another source where that pain might be originating, and saying, the reason I'm saying this is I've also met other people who do this exercise and also have this pain. So I'm seeing if that applies to you. So I think this could be very helpful in situations. We can help people navigate the healthcare system. Good luck. It is such a terrible system. I mean, so as you hear, like I like, there's a lot of medical people I really like. There's a lot of doctors I like, and nurse practitioners, and from many realms. But the healthcare system sucks. So you're going to be seeing this in the next few days. What I would suggest is, we're coming to a big vote that's happening. So I am definitely a political person. I don't need to say who probably my politics lean to, but I will say, try to vote for somebody who will help healthcare for the widest venue of people available. Let's make healthcare truly affordable, right? That can happen. It won't be easy. No matter who wins, it will not be easy. But some people, meaning local politicians, state politicians, and federal politicians, and some of them are more likely to not dismantle healthcare systems, and some of them hopefully will make small changes, maybe even big changes, I'd be surprised, to make the United States have an excellent healthcare system. That'd be amazing, wouldn't it? Yeah, you can chat and say that would be amazing if you like for the moment, if you feel like typing a little bit, or whatever you think about having an affordable healthcare system in the United States or Canada or England, but you all have better healthcare systems. That's just the reality of how it is right now. So next, I'm with you, Taylor. So next is helping people, so I got off track, of course, is helping people navigate the healthcare system. We have somebody who comes to the free clinic that helps people navigate insurance. That's really helpful. But there's awesome people local, awesome, they might be awesome too. There are often local people who that's their job. Like they, it's often for free. They work for nonprofits that help people learn to get insurance and may help them navigate the healthcare system. Find out who those people are and use them for references. It could be very helpful. So you can also have some brochures. I want to read some of the brochures and information sheets that we have in the clinic. We're starting to put some of them in Spanish. I don't speak Spanish, which seems crazy, but I don't. But our clinic coordinator is Latina, and so I have her translate some of these brochures into Spanish. Just one so far, but we're moving towards it. So these are the brochures and information sheets I have at the free clinic. There's so many more you can do. I'm always working on a new one. I got a big donation of turmeric capsules, so I'm actually making information sheets on just how to use turmeric capsules. Not so much about what they do, just on how to use them. So here they are, some of the brochures I have. How to get refills. So just make it easier for people to get refills at the Ithaca Free Clinic, who they have to call up because there's a little bit you have to do to get the refills. I have a couple of brochures. One's called The Patient's Guide to Understanding Herbal Medicine. Very basics. What is an herbalist? What herbalists do? I have another brochure on the various kinds of medicines. Things like, what do I mean by a dropper full? How to use a French press. All these, by the way, almost, I think all of them are free and on my website, which is Seven Song. That's the number seven, sevensong.com. I think they're called handouts or educational handouts. You're welcome to download them and give them away. You can add to them and subtract. You can play around any way you want. I have a hair rinse instruction sheet. I'm going to spend a moment here. So I was working with the clinic coordinator who I just mentioned, and she wanted a hair rinse, and I made her one that was really helped her hair. And she talks to many of the patients, especially Latinx patients. And she just told everybody about this hair rinse. So I got inundated with making hair rinse. It's a kind of tea that I give folks. It's a tea, a kind of tea that they put in after they shower and wash their hair or just get wet, their hair is wet. So I had to make an information sheet because it's a little bit complex how to do it. But I became the hair rinse queen of the Ithaca Free Clinic. I'm proud of it. And then I have one on how to make an herbal compress. That one you need one because it's difficult to know how to make a compress and how to apply it and how to keep it on you. So those are some of the brochures. Back to education and patients. I would think one of the things we can all do is we could be a bridge between, not all of us, those of us who have more of a medical understanding could be a bridge between herbal medicine and conventional medicine. Some people call it allopathic. It's a very common term. I don't really like the word allopathic. First, I don't know, it's not a commonly used word. Also, it seems pejorative, and I don't want to really say negativity about about healthcare workers, forget the system, healthcare workers. So I just say conventional. I say we're holistic. They're terrible terms. There's really, the problem is we're making this artificial division between healthcare practitioners. And so there's really no good word to divide the people because many medical people I know are very holistic in their approach. Another thing we can do educationally wise is we can explain misconceptions, like when Dr. Oz says, everybody should take Garcinia, and people will lose weight, or passion flower, or whoever, right? So sometimes people come in and they really want something because the popular press has said this is great, or the opposite. They say this herb is deadly. Did you never take it? So one of the things I think we have to do is go against some of the popular press ideas about herbal medicine that they simplify and polarize, often either good or bad, instead of the great in between where many things lie. I want to go over just a little bit of the equipment that we use. And this does not include medicine making equipment. This is just the equipment in the free clinic. So if you're going to start a free clinic, these are some of the things I found very handy to have on hand. I modify over time. So the first is a calculator. We need calculators because we have to turn parts into numbers. So if I tell the apprentices work with me in the free clinic. If I say I want a formula, it's going to have Pisidia 5 parts, Matricaria 4 parts, Garia 2 parts in a 2-ounce bottle. You need a calculator unless you're really good with numbers in your head, in order to do that. So a calculator to change parts into a numerical fraction. Labeling equipment. I want to talk a little bit about labels later, but I use a Dymo. I don't have it in front of me. There are small printers. They're thermal printers. The advantage of these small thermal, really, it's just this big. The advantage of the thermal printers is you don't need ink or ribbons. The paper is the thing that's specialized and basically heat transfers. The problem with them is they last maybe a year. They definitely fade. If they're in sunlight, they fade really fast. So that's what I do. The problems also is you can't get so creative. I'm thinking a quarter of all herbalists are herbalists because they like writing labels and drawing. I don't have any creative skill there. So a lot of people love the labels. I put them on the big jars down here, but not there. But they're just really clear. But one of the big advantages when you do these labels is the software saves them. And so all the labels are on my computer. That way I don't have to make a new label every time I see the person, or I could just adjust the labels I already have. Dispensing equipment, you'll need bottles of various sizes, 1 ounce. The thing that you're going to put the medicine into, that person's going to take it with them. So bottles, plastic bags, those are the 2 main ones that I'm using. Having a laptop is helpful for the printer. Also, sometimes I turn it around and I'll show the patient how to maybe order some herbs online or show them a picture of a plant. We use electronic medical records, so I have to have a computer in the office. We've only started that about 1.5 years ago. You'll need measuring equipment. So measuring cups, I have those those small ones. People are going to hate me saying this, but the least expensive 2-ounce cups are sold in Walmart, and they're $2 each. The better ones are $5 each. So to me, a lot more money because they get ruined after a while. So I think that's like companies like XO or OX or XOX, whatever it is, OXO. They have great measuring cups, 2-ounce measuring cups, 60 mils. They work great, but they're about $5 each. But Walmart sells ones that are pretty adequate, and they're about $2 each. If you can find them. I know the difficulties with that company. Also trying to make things affordable for people, which means keeping the price down. It's a tricky subject. Next is notebook and paper, also important to have at the clinic, because I handwrite my notes and then I transcribe onto the computer. I don't want to type. Well, I find that if I type first, I don't type fast, but if I'm typing while I'm working with the person, I find that I give them less attention, and I really want to give the person a lot of attention. I want my focus to be on them, and I'm much easier. I just learned how to write with a pencil and a paper. Maybe like the generation coming up, like the what? Paper? That seems very wasteful. They're kind of right, but that's how I do it. So pen and paper, so I can jot down my ideas, as well as writing down other notes as I listen to them. Not too many more. Shelves. Shelves have been the biggest problem for us. So in our clinic, in the Ithaca Free Clinic, the consultation room that I'm in is, also where I store the equipment. And also all the herbs, so all the tinctures, and I have some pictures online of this. And I need better shelves. So hopefully I got a $5,000 grant. It was so nice. Thank you for the folks who sent me that grant. They're incredibly helpful. And a lot of it is frankly going towards building shelves, so that we have a better system, because right now it's a little wobbly, and it's I just worry about people hurting their back taking herbs off of shelves. So I want to have drawers that are much easier and accessible. Shelves, demonstration equipment. I have a French press that I can show people how to make tea. I don't really fill it, but we use French presses. We'll talk about French presses in a bit, but just demonstration equipment. If there's a piece of equipment that you use, it's nice to have that piece of equipment to demo how to make a compress, how to use a hot water bottle, how to use a French press, how to make tea, those kinds of things. Something that's really, with herbalists, have to really consider is our storage areas, right? So where are you going to store it? You can store it in your home or in the clinic or somewhere else. Herbal medicine takes up a lot of room. Half of my house it's not a very big house, but half of this house is devoted to storage of herbal medicine. So that's a consideration. And if you're at a free clinic, where are you going to store it? Or any clinic, where are you going to store it there? So I want to talk quickly about labels. Really what I want to say about labels is when you're using labels, make sure that they're really easy to read, and try to avoid terminology like specific medical words when you're working with people. So, what's called layperson language, if you like, but just, so some, even words like steep the tea. Some of my patients just don't know that word. It's not a part of the vocabulary. So I can ask, do you know the word steep? And if they say yes, and I can put it on their label, type. But keeping the labels clear. So for me, the labels have a few things. On the side of the label is how they can get in touch with the free clinic. The very top of the label has a name of their medicine. I often name it with them. So it might be, Marvin's back pain tincture. They'll always have what it is, tincture, glyceride powder, etc. Then it has the ingredients. I just put the common names of the ingredients. So it might say Solomon seal, gotu kola, licorice. Then the bottom, this label's not big. It's, like this big. It's pretty small. So it's your classic address labels. That's what I'm using, address labels. And then the other thing that's on the label is directions. which often you need like strong glasses to read, but that's what's on the label. So that's what I just want to say. Make the labels accessible. Talk to the person when you give them the medicine, make sure they can read it and understand it while they're in the office. All right. So what I'd like to do now is move more towards the herbal section of this class. Does anybody have any questions? I could spend a moment or two. I see there's one here. And if you have any questions. Robin asks, in part one, did I cover how we get doctors and herbalists to participate in a free clinic? If what you mean, Robin, is so there's two, I hear two questions. Well, I'm making up two questions. One of them is how do we get them to just come to the free clinic? And the other is how do we get them to interact with each other? How we get them to participate is that doctors ask other doctors if they'll help us. Pretty much all of our doctors are retired. I mean, that's basically who we get as doctors. Nurse practitioners, sometimes they're not retired, sometimes they are. The nurses frankly, are often retired as well and have time, but still have the licenses because we still have to assure them in the free clinic. And then herbalists, I've been there the whole time and I've trained a few people who have come in. So that's how I've gotten herbalist. I think a lot of herbalists would like to participate, but I am very, very choosy because I want to make sure that herbal medicine is used correctly. And also I want to have long-term dedication to the clinic and everything else that I've said, it's got to be about the patient. So that's the answer to that question. I see one more question here. Lori asks, should I use the scientific name of the plant on the medicine? I don't. I have separate notes from them, but I always just give the common name. I feel like it would just be confusing and nobody has ever asked me for it in like 14 years. If I have somebody who's clearly like somebody who gathers, like somebody who's just really involved in herbal medicine, then I might write the botanical name on there for them. But otherwise, I just will say licorice rather than Glycyrrhiza glabra or any of those. If people ask for me, it would be actually hard to fit it on the label, but more so, I think that it just confuses the issues. I think not the issues. I think it just makes the label harder to read, and then people don't read it, and then they might miss parts of the directions, which follows after that. All right, so here we go. You all doing good? All ready to vote in November? Maybe you've sent in your mail-in ballots already. So first, the different types of preparations that we regularly use to clinic. There's many more than this. These are the ones we regularly use. So by far, I use tinctures more than anything else. The reason for that is convenience. They last a long time. I can have, I probably have 80 or 90 at the clinic. And so, excuse me a second. And so I can just store a lot of them and make medicines. So tinctures are number one. Something that follows close by is tinctures with glycerites added. So glycerites are plants that are extracted in vegetable glycerin. I usually don't just give, I do give just glycerin to some people. I'll get to that in a moment. But sometimes I just, in order to soften the flavor of a strong tasting herb, I might add something like rose glycerite, if rose is useful, or chamomile glycerite, because those are useful plants. Plus, they alter the flavor of the medicine. So before we give anybody tinctures or anything with alcohol in it, we always ask if alcohol is acceptable for them. I've talked extensively about this in the previous one, but nobody gets a tincture without that question. If there's any alcohol in the medicine, there's always the question of, are you okay with alcohol taking internally? Probably the next most common are tea. We have lots and lots of teas. What I mean by that is we have lots of plants in bags, and then we make tea for them as needed. So tea takes up a lot of room. It's one of the harder things to work with. Also gets all over the carpeting, which we have to vacuum up afterwards. But many people do like tea, and so we have a lot there as an option. The next one are glycerites. I described them for people who don't want alcohol or just want glycerites. Then we have glycerins for them. After that, we have capsules. We've been making more capsules. Capsules are a lot of work. It just takes so much time to make capsules, but we are doing them more. We've been getting a lot of donations of powders, and because it's hard to powder them. I have some reasonably good powdering machines, but still, they're a tiny bit chunky, and you just want it, if you're going to put that in your mouth and swallow it, you want it to be a fine powder for the reasonable absorbability. So we've been making them, but they're just extremely time intensive to make capsules, but I would make more of them. But a real, not one of these little hand capsule machines, but a bit that's like $20,000. Not something that's ever going to be a part of my life, unless one of you wants to donate one. So back to here, and then sometimes just powders by themselves. So sometimes they'll just take the powder, put it in water, stir it, and drink it. So those are the most common internal medicines. Externally, the most common medicines are oils, infused oils, like calendula oil, where you take calendula and put it in like extra virgin olive oil. Sometimes we add essential oils into the infused oil. So the infused oils, you take a plant, put it in an oil, then strain the plant out. You have an infused oil. Then the essential oils are the ones that you buy that are very strong and pretty much all poisonous in large doses. So those things should be kept away from children or anybody who might drink them, because all essential oils in medium to large doses are dangerous. They just move through tissue so easily that they can cause harm. So we infused oils, we give salves, which is an oil with a beeswax base. Sometimes I'm working with somebody right now who has has a toenail fungus. It's been going on, or it's actually a thumb fingernail fungus that's been going on a long time. And so I gave them an instruction sheet on how to do it. I gave them chaparral. So what they're going to do is make a strong chaparral tea and then soak their thumb in that a few times a day for the fungus, and hopefully that works. Chaparral is one of my favorite herbs as an antifungal. And we also use liniments. Liniments are plants based in isopropyl alcohol. So ethanol alcohol is the drinking alcohol that's in tinctures. Isopropyl alcohol is the alcohol in rubbing alcohol. You can use tinctures anytime you can use a liniment, except that isopropyl alcohol is half the price of drinking alcohol because it doesn't have that tax. So we use a lot of liniments to rub onto sore joints. Well, that's some of the main ones. So those are the preparations. I'm hoping that I'm hoping I'm not speaking too quickly here. I guess you can watch it again if you can bear it. And then the next is herb-drug interactions. So I'm going to only cover this briefly. I covered this previously, but I just want to, comes up and people often ask me these questions. So what about herbs with people taking pharmaceuticals? The answer is most of my patients take pharmaceuticals. They take a variety of medications, 1, 2, 3, 5, 7, many of them. This is not an easy subject to address in a quick class. So what I want to say is be cautious. Just understand the nature of the medicine and let the patient know about possible interactions if you know them. So it's very poorly understood how herbs interact with drugs. There's very few studies. A lot of the studies are haphazard or just kind of in somebody's mind, like this does this, so this dude does this, I mean theoretical. And a lot of times they don't show up in practice. I give lots of herbs to people who take pharmaceuticals, and we just put in kind of have them get things measured or have them try to be aware of their body. This is a bit cavalier, like it's hard to know how the herb is going to affect the drug. Most of my personal experience at this point is that the herbs often augment or increase the efficiency. So they're taking Lexapro for anxiety or depression, and I give them a tincture of Damiana, hops, and skullcap, and often I find that the two together work. But here's the crucial thing. The more important the drug is for their life and health, the more important it is to really think about the implications of the herb reducing the efficiency of that. So there's no easy answer to herb-drug interactions. Herb-drug interactions. What we have to do is just be aware, and then if people get labs, we can check their labs to see if the values of their of what's ever going on in their body or the value of the drug. Not measuring the drug, you usually value the measure like the blood viscosity, and then make decisions based on that. But I just think when people ask if it's a possibility, the answer is yes, it is a possibility. We're still learning, and we just have to really be cautious moving ahead with this, understanding that we could impact. Again, though, a lot of the times I'm working with people, they're on pharmaceuticals, and then herbs seem to sometimes really seem to help a lot with that without making the drug work less. But again, it's hard to tell. So I'm going to move off of that subject. That wasn't that helpful, but it's some of my thoughts about it. What I'd like to do now is to talk about some of the common recommendations that we make at the clinic. So the first time I see people, often these are the recommendations I make as far as this is the herbs that I give them. Recommendations might not be the best word. So what I want to say is that the first time I see somebody, unless they have a history of taking herbs on a regular basis, I start off with small amounts. It does mean that they have to come back for more, usually within a week or two. But it's just so common that people don't take the medicine that I don't want to give medicines that won't be taken. So the first time I see an individual, often I'll give them about an ounce of a tincture. Again, if this is a person who's never taken herbs before and has no history of it, an ounce of a tincture, as we'll talk about soon, actually might just last them 5 to 7 days, depending on how much they take of it. If they want more, it's free. And the next bottle will usually be a 2-ounce bottle or a 4-ounce bottle. So the next bottle will be a larger size to last longer. We do the math, at least internally, I'll do the math to think, how long will this last? I'm going to talk about dosage after I get through this. If it's a tea, it's usually about 1.5 ounces, the initial amount. That's very little. Most teas that people make is about 1 ounce to 1 quart, and usually drink about 2 cups a day. So 4 cups is about a quart. So that could just last like 4 or 5 days. But I just want to see, or 3 or 4 days, I just want to see if people want more of it. If they say they know they're going to take it, I might give it to them. But again, just because it's free doesn't mean I want to give it away and not have people come back and feel like I'm wasting herbs. So, but if people come by regularly, which many do, we just continue to give refills. We continue for years, sometimes, to give people refills. So I do sometimes discuss lifestyle changes, exercise, diet. It just depends on the relationship between me and what that person's asking for. I mean, if they're not really asking for those things, I might ask something about their diet if it seems like it might affect them. But I want them to feel comfortable with me initially. I want them to feel comfortable with me throughout the whole time, not just initially. But I want them to have some trust with me. And so I'll ask questions that seem pertinent, but maybe not too impositional. And then later on, maybe discuss it, or maybe they bring it up. Like a very common issue for people is weight gain. Sometimes people are very thin and want to gain weight, but societally, they might have more leeway than somebody who's heavier. Anyway, there's a lot of issues about people with their weight, is really a better way to say this. And so if they want to discuss it, we can talk about it. But there's no herbs that help, there's no Garcinia herb that helps people lose weight fast. Weight loss is difficult. We do have a nutritionist there, but there's, as a person who has a little bit of an understanding, we can discuss it, see if we can increase a little bit of physical exercise. But what I try to say is, it's up to the patient, right? I'm there to listen to them and try to help as best I can by what they're discussing with me, and see if it comes up. Also the comfort level. I think that's it. Those are just some. There's a lot to cover, and so I'm going to keep going with that. Hopefully, that was a little bit useful. Dosage considerations. It's really important. Herbal medicine, again, is tricky on how much to take. So just show people, like, when I say a dropper full, meaning for anybody, I mean a full dropper. And so usually what we'll do is we'll show them that if they fill it, I don't want to bring it too, I don't want to spill on my laptop, but that's about a half dropper. That's about 1 milliliter right there. It's a little less than 1 milliliter, like 0.8 milliliters of medicine. So if somebody's going to take 2 dropperfuls, or let's say one dropper full, which is 2 milliliters, We'll just show them, oh, you do this, and then you do it again. We just give them visual demonstration. By the second or third time, they got it. So usually, but we do it until they understand it to make sure they, because the word dropper full is one of the hardest words of all, because droppers don't fill when you squeeze the rubber top of them very easily, right? So you have to describe what you mean with this. So what I want to say is, though, it's really helpful. You don't have to tell people this, but just to give you an example, like if people take 1 dropper full of a 2-ounce bottle, or let's say 1-ounce bottle. Let's say people take 1 dropper full. I don't have a 1-ounce bottle. 1 dropper full of a 1-ounce bottle twice a day. How long will that last? So 1 dropper full twice a day. So 1 dropper full is 2 milliliters. Twice a day is 4, right? So if they're taking 1 dropper full, which is 2 milliliters, twice a day, that's 4 milliliters a day. And it's a 1-ounce bottle, that's 30 milliliters. That's going to last 1 week. You know, it's going to be approximately, so 28 milliliters, which is really closer to 30 mils. So I just want to point out that after the first time you see somebody, be realistic. Like, because often I feel like herbalists say, just take this like 3 times a day for the next month, and it's gone in 5 days. So be realistic with your calculations. It's easy. A 1-ounce dropper or a 2-ounce dropper. This is the same size. 2-ounce droppers are just thinner. They hold approximately 2 milliliters when filled. So if you say like take 1/2 dropper full, that's 1 milliliter, right? So they took 1/2 dropper full once a day, 1 milliliter once a day. It would last, that would be 60 milliliters. And actually this bottle would last a month, but it's pretty rare to give like 1/2 dropper full once a day, right? If my numbers are a little off and you're paying attention, I sometimes, I'm not the best at math, but if I sit down and figure it out, it could be beneficial for, for me, for them, just thinking, okay, this is going to last you 2 weeks. This is going to last you 4 weeks, because they're going to have to come back to the clinic. We don't mail medicines. During COVID, we delivered medicines, but we're moving away from that, and people are now coming to the clinic unless there's a health reason they can, and then we still deliver the medicines to their homes if they live within 30 minutes of the greater Ithaca area. So that's it, I think. Any questions on any of that before I start talking about specific? I'm going to talk about some of the things we see regularly, and then specific herbs. So questions about this? All right. So next, what I'd like to discuss are some of the things that we commonly see in the free clinic. And then I want to talk about some herbs, and we're going to probably stay with herbs and treatments for the rest of the hour of this class. So these are in alphabetical order, not in order of what we see them, but these are things that we very regularly see. So you as a clinician at a free clinic might also see these regularly because they're very common. So allergies are extremely common. Right now, people are having some mold allergies as people start to come in. And if they live in a moldy place, it's wet in many places. So one thing we don't see, so I'm going to just jump off for a minute and come back, is if you live in Colorado or in the West, smoke inhalation is definitely something you're going to see. I wrote a Facebook post about it. I think maybe an Instagram post that you can look at. But basically, smoke inhalation is something I don't see that often because I live in the Northeast. But in other places, that can make breathing way more difficult and cause chronic healthcare issues over time. But I started with allergies. There are a few, for all these is a few good herbs. I'll get to the herbs in a little bit. I would say the most common health concern that I see is anxiety, and people might also call it stress. So, because this makes everything worse, right? So sometimes people come in for one health issue, and then as they start talking, they start relating more of what just seems more anxiety and stress in their life. And there are many herbs that might be beneficial for that. But I would say anxiety and stress are very common. Arthritis is common. Autoimmune conditions are very common, everything from lupus to Crohn's disease, to celiac disease, to rheumatoid arthritis. There are some medications now, some of the biologic drugs, often they end with MAB, that have some potent side effects, but also can really, for some people, they're really making a big difference in their autoimmune conditions. So there's definitely a movement in the medical world. Yeah, I mean, like just explaining on how expensive they are is phenomenal. But I do want to say that those things exist and people can afford them or have access. They can be really helpful. And there's also herbs, but they do initially have side effects. Anyway, so autoimmune disorders, cardiovascular, very common for folks to come in, including chronic venous insufficiency, hypertension. Let's go over a few more. A very common one that people come in to see herbalists are conditions that doctors cannot diagnose. So the person might feel fatigue, or they might use terms like out of it or brain fog. This is really common. We as herbalists often don't diagnose or even assess, it's just symptom treating. So somebody has a chronic fatigue syndrome, they're tired all the time, sleep does not refresh them, and they get all the tests and all their tests come out negative, their Lyme test comes out, everything comes out negative. I think herbalists, we have lots of options to help folks. And we don't necessarily have to have like, this is what it is. This is who you are is what we're working with. And how do we address this? You know, what herbs might be helpful for you? Dermatological issues, chronic rashes. Dermatological means skin. Diabetes. Mostly I work with diabetes type 2. Diabetes type 1 is basically also an autoimmune condition. But most of the people I'm working with have type 2 diabetes. I'll talk about some herbs from them. So I'm just going to start reading the list so we get further in this. Digestive problems, fatigue syndromes, estrogen and reproductive issues, menopause, general health checkups, questions about herbal medicine. Somebody just comes in and they just want to know more about herbal medicine. Gynecological health issues, headaches, idiosyncratic health issues, chronic infections, insomnia, Lyme. They want to talk about their medications and pharmaceuticals that they're taking, a wide range of mental health issues. Pain, of course, is one of the most common things that people see anybody for, and certainly they see herbalists. Respiratory issues, COPD, COVID, asthma, and then weight. So these are some of the issues that we see. What I want to do now is just, again, what I would like to do, but first I'm going to stand up for a minute and just move my body. Hitch up the pants, sit back down. I hope you're doing that well out there, whatever day it is for you. And what I want to do now is talk about some of the herbs. Again, this is not a class on the specific properties and how to use all the herbs. What I want to say is these are some of the herbs that we use very regularly in the free clinic, and why I think they're important. So just a few words about each of them. So I'm going to give you the name of the plant and then the botanical name of the plant and then some of the uses. I'm not going to spell any of these out. Hopefully they're pretty easy information to find. They're in alphabetical order. So the first herb that I want to talk about is calamus, which is Acorus calamus. The main reason that I use calamus is to help people who have focus issues after injury or disease. So for instance, if somebody has Lyme or they get into a car accident and then afterwards they find that their memory and the cognitive ability and the ability to focus is impaired, then calamus is one of the herbs that I use the most. It's pretty strong tasting, but you can make it into a glycerite, which is just a strong tasting glycerite, really. But that's one of the main ones. Just as a teacher, so I have a teacher, run an herb school. So here's my trolling moment. I run the Northeast School of Botanical Medicine. We're actually going to try to be live next year, meaning in person. Hopefully everybody's alive. And if you like more information, go to my website. And then I write very clearly, I try to really delineate what next year might look like or might not look like. So because nobody knows what's going to, right now it's on the rise. So meaning COVID-19. So I don't want to BS anybody. I want to be transparent in my decisions and your decisions that you're going to make. So anyway, I got there as saying that I'm a teacher because many of my students lose focus. I mean, everybody loses focus listening to the same person. Right now, you're probably losing focus saying, get back to Calamus 7 song. So, but sometimes I don't really know if it's just like a smelling salt or something, or it's just some very strong pharmacological reaction. But often when people take Calamus, it does help their focus, at least temporarily. So I, as a teacher, I keep a bottle in the classroom for students to use if they feel like they're losing focus and want to gain it back. It's not there's no miracle herbs, so it's helpful for some people. But I really like it post-disease and post-injury to help see if we can restore cognitive function, particularly focus function. You'll be able to stay on track with something for a while. The next herb is black cohosh. Black cohosh is Actaea racemosa. Black cohosh has two very specific uses that I use in the clinic. The first is it's a skeletal muscle relaxant. So if you've hurt your neck or if you've hurt your back and you have tension in there, a very common place to hold tension, black cohosh can be helpful. So black cohosh is going to get some warnings with it. So I would say don't use black cohosh if you're pregnant or if there's any problem with estrogen in your body and you are going to start taking it. For instance, you're taking hormonal supplements of some sort, HRT, hormone replacement therapy. Just be careful if the person's taking tamoxifen because they've had breast cancer, and so tamoxifen is an estrogen antagonist. I would also avoid black cohosh. So, so that's a wide range of when I don't use it. And I want to say one more thing about black cohosh, is that it's one of the plants that I find makes some people irritable and occasionally causes headaches. So it's a strong plant. On the other hand, it has two really strong uses, and I use it for both. One of the main uses that I use it for is what I've just said, as a skeletal muscle relaxant, often with other plants. The other place is as something that agonizes, that increases estrogen receptor activity. So for instance, menopause, when there's hot flashes and somebody wants to reduce their hot flashes, sometimes black cohosh can be very helpful. Sometimes if somebody has menses dysregulation, menses cycles might be too long or too short for their norm. And then sometimes it could be helpful for there as well. So black cohosh both works on estrogen receptivity in the body, probably other hormones as well, but clearly estrogen and probably some progesterone. And it's a skeletal muscle relaxant. And so I'm suggesting it for that. So I'm going to read a question or two, and then I'm going to come back here. So the first from Judy asks, what amount of black cohosh for back pain? I would start a low dose, Judy. I would say a good dose to start with it would be about a half a dropper full, 2 to 3 times a day. So 1 milliliter, 2 to 3 times a day, and see how that works. And then you can always raise. Laurie asks, can black cohosh impact oral contraceptives? I've never seen that. I've never seen black cohosh increase, I'm not sure how that would look, or decrease oral contraceptives. And the herbalists I work with haven't talked about it. That doesn't mean it's not true, but quite a few patients take it. So I haven't seen that. I would need to see some more research or some clinical evidence that it does that, but I haven't tried that yet. And then Peggy asked about addressing diet and sleep with people who come in. And I just mentioned it briefly. And the answer is I do sometimes address diet and sleep with people. It just depends on the circumstances, who they are, the relationship, and the counseling session is going along, the consultation. So I'm going to keep going here. And then if you have questions, I'll probably answer them later. So it stays a little bit more on focus. The next herb that I use is, again, these are just so if you're wondering where my alphabetical order is, it's in the scientific name. So the common names are not going to be in alphabetical order, but the scientific name will be. So the next herb is horse chestnut. Horse chestnut is Asculus hippocastanum. Asculus hippocastanum. And so horse chestnut, I use it both internally and externally for chronic venous insufficiency. That means your veins are not carrying your blood well back to your heart, and you start to get edema in the lower limbs. So that's one place that I use it. If you ever read the Cochrane Library, Cochrane, pronounced Cochrane, Cochrane Library, probably the best mark they give to any herb is to horse chestnut, specifically for chronic venous insufficiency. So that means I also use it for edema when it's due to chronic venous insufficiency and for hemorrhoids, which sometimes have to do. So basically the veins aren't working as well as they can be. And sometimes for varicose veins as well. So basically we would say that horse chestnut is a vein tonic. For some reason, the word vein becomes venous without you drop the I when it's medicalized. So that's it. Mostly I use it internally. I'm not going to go for dosages for each thing since it's so individual. It would just take, I'd have to give a range. But I can say what I give it the form. Horse chestnut, I give it mostly in tincture. I have in capsules, the other form. It's been a while that I've had the capsules. And then externally, both in an oil and a liniment in the area that you're trying to improve venous health. The next herb is mimosa. So not the drink. Well, I guess you could drink it, but mimosa is also called tassel silk tree, I think, silk tree. And it's Albizia julibrissin. Albizia julibrissin. And this plant, I've been using it more and more. I have some concern about, there's some evidence that it might not be good to give folks who are bipolar, especially the bark of the plant. So I'm giving a warning about it. But I use it a lot for anxiety and depression. It's one of the few plants that I find equally useful for both anxious and depression. Many people have both, but even if they don't, I often give it to them. And I use the inner bark of the plant. That's people also use the flowers, but I don't have access to the flowers. And mostly I use it only in tincture form because it's the only form I have it in currently. So for anxiety and depression, I can also just say when people just seem sad way more than they want to be sad, it's also when I give Albizia. Frankly, that's one of the big indications for me. The person just seems sad in a way that they can't get out of their sadness. I mean, sadness exists, right? There's many, many reasons to be sad. But if sometimes something like Albizia somehow alters the nervous system a little bit, where it might make it a little bit easier to be a little less, be a little bit more involved in life, being a little less sad. But it takes, there's other work that needs to be done. The next herb is Siberian ginseng, often called Eleuthero ginseng. The plant is Eleutherococcus senticosus. Eleutherococcus senticosus. This herb I use with other herbs, often under the category of adaptogen. But really what it looks like to me is I have an unidentified health care problem that often leaves them fatigued very regularly. And this is the most common time that I use it. So they might come in with a diagnosis of chronic fatigue syndrome, or fibromyalgia with fatigue as a part of it, or Lyme disease with fatigue as a part of it. So they might have a diagnosis or no diagnosis, but it seems like Eleutherococcus and other ginsengs, so this is going to be nebulous terms because that's the best I have for this, help fortify the body in a way that helps people feel a little stronger and less fatigued. On the specific systems it's working on, I'm not really sure. It just seems that it helps overall tone. So again, these are ambiguous, nebulous words, but there are some books that give a lot more depth to it, but that's where I use it. I use it, especially though somebody comes in, all their tests are negative, but they don't, even if they sleep well, they don't feel refreshed. They might take very long naps. They just feel kind of out of it a lot of the time. And they also might be getting sick way easier than they used to. Then Siberian ginseng is one of the plants. We use it in powder, capsules, and tincture. That's the way that I use it. It's a fairly safe herb. Every once in a while, it makes somebody feel a little too revved up, but that's not that common. The next herb is ragweed. This one often sits weirdly on the list for some people. So ragweed is that plant that you're thinking about that causes a lot of allergies. Like I think 70% of all hay fever in the Northeast comes from ragweed. But the leaves of the plant have a bit of an antihistamine effect. So when I say this, often people are like, well, the thing that causes it stops it. I don't think that's true. We can think of some politicians who are causing a lot of disruption. They're not what's going to stop the disruption. So, but also just bringing it down to plants, like, do not rub poison ivy on poison ivy, hoping that it'll get better, right? So ragweed is one of the weird exceptions where the pollen of the plant causes allergies, but the leaves have somewhat of a histamine reducing effect. I think it's one of the strongest. So the question always is, so I've talked a lot about ragweed in many classes, is if you have ragweed allergies, and you take the tincture of the leaf, will it make it worse? And the answer is it will not. It's the pollen in your nose that causes the allergy, not the leaf tincture in your mouth. So I pretty much just use it. I think I only have it in tincture form right now. But it's plenty, you can, if you're going to gather it, if you have allergies, just gather it way before the pollen comes on it, and that should be fine. People don't get it from touching it. It's really the pollen in your nose causes all those allergies. So ragweed for allergies, and what I would say is histamine-induced allergies. The runny eyes, the itchy throat, lots of mucus, those kinds of allergies. Whether they're caused by pets, food, or pollen, it could be helpful. But sometimes it's not strong enough, and other medicines might be needed as well. The next herb is, I'm going to give the genus of the plants and then describe some of the plants in it. Again, I talk about this plant a lot because I use it very regularly, more in first aid. And so the genus of the plant is Berberis, Berberis. The plants in Berberis include things like Japanese barberry, not Japanese knotweed, Japanese barberry, Oregon grapefruit. Well, those are two of the main ones, really. There are many Oregon grapefruits. Sometimes the Oregon grapefruits are called agarita as well. But they're all in the genus Berberis. Some of them were formerly in the genus Mahonia. The reason I use barberry plants and Oregon grapefruit plants in the genus Berberis, is for their antibacterial and their antiviral action. So while some people will dispute that something cannot be both antibacterial and antiviral, I would dispute back saying plants have lots of chemicals in them, and the antibacterial part of it is more direct. And it could just be that the berberine in the plant, berberine is the chemical that makes it yellow, stimulates the immune cells, which then have an opportunity to kill viruses. So Judy just asked about golden seal, because it also has it. I've just stopped using golden seal. I have a little bit left. I just want to not use, so it's personal, but I feel like golden seal has been so over harvested from the wild. People do grow it, but I have friends that grow it and they get poached. So I'm just like, these plants I think work just as well as golden seal without the environmental and personal disruption that golden seal brings. And so golden seal does work. And if you're growing it, certainly grow enough and make medicine from it. So thank you for pointing out that, because that's like the classic berberine containing plant. But at this point, I use very little. I'll use probably none after I use up the golden seal that I've had around for quite a while. So berberine, berberine containing plants, Berberis species, I use them externally on wounds, on infections, and internally on infections. I did a class not long ago on staph infections, and you'll find that externally and internally, one of the plants I rely on for staph is Oregon grapefruit, Japanese barberry. And so you can look up all my videos. Again, if you just go to YouTube and type in 7-Song Herbalist, you'll find a whole bunch of videos there. I'm trying to, today I think I got the lighting a little better. Often the lighting is just weird. So hopefully I get to be a better speaker. I'll use my eyes more, I'll use my hands more, I'll use jars of water more to get the Zoom thing down. While I'm at it, another thank you to Michelle for helping me get through this process. So I think somebody just pointed it out, but I'm going to just point out did say that Oregon grapefruit, berberine, the chemical in it, berberis, the genus, berberine, the yellow chemical alkaloid to be specific in it, is good for diabetes. And I use it very regularly. There's actually lots of science on it. The science is on berberine. I use berberis, I use the plants. But actually I can see that it helps because people get their blood sugar tests, the A1Cs, on a very regular basis. So sometimes their A1Cs are, I don't know, 8.7, and they've been taking the metformin and other medications, and it's kind of stubborn in there, and you add herbs, and then it maybe drops it to 8.1, right? So you're not near your 5.8 range yet, right? That's where you really want to be, but any step down is a positive step. So I use it mostly in tincture and glycerite form. Glycerin does not raise blood sugar, and if it does, it raises it very little because how our body processes glycerin. So glycerites are safe, but those are the two main ways I've done it. One day I'll probably start making berberine capsules as well. When I get some in powder form, I'll start using that. By berberine, I mean either Oregon grapefruit, that's the root is powdered, or Japanese barberry, where it's finely powdered. So for infections, viral and bacterial, I've also used it for protozoal infections, and it looks like it's helpful there too. Protozoal infections would be things like amoebic dysentery and giardia. I want to say one thing though, it's a very strong tasting plant, and often you have to give large dosages for it to work. And then also with blood sugar, with type 2 diabetes, the person takes it usually 2 to 3 times a day, but not just following meals, just regularly. 1 time a day minimum, but usually 2 to 3 times a day for it. And so again, the most common form I give it to is tincture, followed by glycerite, but I hope to get some capsules, make it easier. The next herb is gotu kola. So gotu kola is Centella asiatica. Centella asiatica. It's pretty popular. I recently went to an Indian store and selling things from India, and they had like all these very, very sweet, like just like sugar, and then a smidge of gotu kola in it, but a big gotu kola leaf on the can. So it's becoming popular, but I think it's really useful. And so you can look up a lot of information about gotu kola, but I use it for a couple of specific ways. First, for connective tissue restoration. So there's actually not a lot of herbs I know that help connective tissue. So you've gotten surgery, you've torn your ankle, you've hurt your meniscus. I mean, all of our joints break. I mean, moving parts break down, right? And so all the moving parts, often you can have connective to make life seem so positive. All the moving parts can break down. So this is not the inflammatory state. So if you have arthritis, it's not gotu kola because often you have inflammation and then you need other herbs that are anti-inflammatory. But if you have damage to the joints or you have damage to connective tissue, then gotu kola is a good choice. Usually it's used internally for this. I also make an oil. Mostly I give it in tincture and liniment. I haven't used a liniment very much, and an oil base. So gotu kola is really good. But you have to take it for a long time. So you've had some surgery and now it's not going to heal the scars. You're hoping to help heal the connective tissue internally. Or again, you've just taken a really bad sprain. You twisted your ankle or knee. And now you want anti-inflammatories initially, but if it still hurts after a long time and there's some damage, then gotu kola comes in place, both externally, but even more important, internally. So that's one of its main. All right. So the next use of gotu kola is a little bit different and a little bit similar to calamus. It seems to help cognitive function after an accident, so disease or accident. So there have been some studies with TBI, traumatic brain injury, with gotu kola. It's hard to really assess the outcomes of that, but they look pretty good. What it actually looks like, it might increase peripheral circulation into the brain, which might bring in more white blood cells, which might help increase scavenging damage, or something within this realm, or helping bring more oxygenation into the brain, doing the same thing, passing the blood-brain barrier. So gotu kola I use with people whose memory and cognitive function has decreased after either an injury, a car accident, a skateboard accident, a bicycle accident, a falling out ice accident, you hit your head, any of those, go to cola regularly. And also after disease. So you've had COVID for a long time and you feel like your brain functions down, you've had Lyme disease or really any disease. I feel like it's really helpful. I feel like it's really helpful both as a connective tissue tonic and help to increase memory and cognitive function. It's purported like when you read about it, it seems like if you take it, you will be better memory, you'll have better cognitive function. But I don't think it really increases it unless there's a problem with it. I mean, we all have a certain cognitive function, memory level, focus level, all of those things. So I don't think it's some kind of whimsical, magical device. But for people who have had changes to their brain function, I think very helpful. As you can imagine, I often do it with calamus. Calamus is better for the focus, and calamus seems to work more on the brain in the sense of focus or wherever that is. Well, it's really going to be a brain. Whereas Gotu Kola is probably helping do more repair, maybe to tissues around it, blood circulation, etc. So a big fan of Gotu Kola. Centella asiatica. The next one is cinnamon. There are many species of cinnamon, and I've used a number of them. Really helpful. So first, you can use cinnamon as, here's a technical word, a corrigant or a flavor enhancing agent. So cinnamon, it tastes like Red Hots. I don't know if you ever just tasted like cinnamon tincture or cinnamon glyceride, but if you ever had those Red Hots, those weird jawbreakers from my youth, those big candies, man, I can't imagine this stuff is legal. Anyway, those have cinnamon essential oil on them. That's what makes them hot. So if you have a tincture that doesn't taste good, you can add small amounts of like cinnamon glyceride into it, and it can make it taste cinnamony if that's what the person likes, cinnamon. But that's not why it's here. It's here because cinnamon, like berberis, the Oregon grapefruits, and the Japanese barberry, also helps with type 2 diabetes and helps with what's called insulin resistance. Both of these plants help. The berberis containing plants, the berberis species plants, and the cinnamon help with what's called insulin resistance or metabolic syndrome, which is a big part of type 2 diabetes. So with people who are trying to bring their A1Cs or their numbers down, their blood sugar numbers down in diabetes, often what I give them is a combination of half Oregon grapefruit or half Japanese barberry and half cinnamon. These days I'm using Cinnamomum bermanii. It's a very common form of cinnamon, but you can use verum or any of the other species. They do have slightly different properties. They definitely have different flavors. But that's what I mean. I just got a bag of really high quality Cinnamomum bermanii, but it smells, it's like a more mild cinnamon. And so I use cinnamon mostly for blood sugar control. And then the person, it's either in tincture form or a glyceride form. I don't have it in capsules yet, but of course I can make capsules because it's in powder. I mean, easily to buy. So when I say cinnamon, I mean the stuff you buy, McCormick cinnamon or the Green Star or Frontier cinnamon. All those cinnamons are useful as long as they have a good smell, as long as they're fresh. If they're really old, they probably don't work. There's a lot of good studies on cinnamon for blood sugar as well, meaning clinical trials. All right, let me see if there's any questions here and then go on further. We're gonna get through we have about a half hour left. All right. So the next herb is hawthorn. Hawthorn is the genus Crataegus. I like to use the flowers and the leaves and then the fruits medicinally. So I think the strongest part, I mean, this is what pretty much all the trials say, that the leaves are the strongest, though I tend to like to use the flowers because I like those other flavonoids in there with some leaves. And then also I make the fruit, as I take the tincture of the hawthorn hoa, proving Long Island accent, hawthorn hoa, and I often tincture them separately. Well, I always tincture them separately because one's in May and one's in September. And then often I add them together. I add them together because the fruit makes it taste much better and has some of the medicinal qualities. So what I'm saying is I give hawthorn regularly as a glycerite and a tincture, and often it's half or a little more flower and leaf, and then half fruit to just increase the flavor, and you get some other chemicals in there as well, some of the constituents. I use hawthorn as a cardioprotective agent. So for people who have had any kind of heart damage or high blood pressure. So it doesn't lower our blood pressure. Very few herbs that are safe lower blood pressure. So there are some that do, the cardioglycosides do, but you have to really know what you're doing, and you have to work with a very competent herbalist, and the person has to, you have to just be really diligent in how much you're taking. So I'm not using those herbs, the cardiac glycosides. So basically for people who have had heart disease, heart failure, have high blood pressure, hawthorn is a great herb, not because it changes the systemic effect of those illnesses, but that it looks like it increases the strength of your myocardiocytes, the cells in your heart, the major cells in your heart that basically cause the pumping. Like you have some cells that make the electricity go around. You have some cells, the majority of the cells, the myocardiocytes, allow it to do the squishy bit, the pumping. And so those can get damaged, as well as nearby arteries, the main artery. And so hawthorn looks protective for that. Maybe the artery, definitely the heart. So the one thing about hawthorn is something the person's can be taking for a very long time. It's not you don't take it, it gets better, and then you're better, and then you stop. You should be taking it for long periods of time. So again, tinctures, glycerites are okay. I think they're not as strong, I think. And then powders of the plant and capsules. So those are some of the uses for crataegus or hawthorn, and taking it regularly 2 to 3 times a day. The next herb, ready? The next herb is echinacea. Echinacea has been one of the #1 selling herbs in the United States, maybe Canada, for like 100 years. That plant just maintains its status. It's at all. So there was a long time when nobody used it, right? I mean, or many less people used it. You know, anywhere from like the 20s to the 70s, unfortunately, when there was a real depression, especially amongst, I don't know, amongst many people. And so I do like echinacea. It is overly touted, but I think it's useful. And the reason I like it is because I feel like it stimulates, I mean, there's a lot of studies that it stimulates both adaptive and innate immunity. So these are 2 separate parts of the immune system. They have a lot of interaction. You know, the innate immunity can stimulate adaptive, and there's probably parts of adaptive that can downregulate or regulate innate immunity. Simply, innate immunity is the immunity you're born with, and it's what happens immediately after something happens, like a cold, or if like the first thing that comes into play, or a cut on your skin, or any kind of infection that you get, your first response is your innate response. And you're born with your innate response. Your adaptive response are different kinds of white blood cells called T and B cells, and they look for specific things to attack. So when you get a vaccination, right, when you get an immunization or vaccination, what you're trying to do there, so vaccination is the thing, the shot, immunization is what happens from a vaccination. So you're hoping that they both happen. The vaccination causes immunization. So what you're doing is basically when you're putting a piece of, let's say, the COVID-19 virus, so that's what's happening now. They're going to take the COVID-19 virus, they're going to break it down, find the part that's non-destructive. They're going to do all the things and eggshells that happen with this. I'm not going to go beyond my knowledge here. And then they put it in your body that stimulates your T and B cells, one of those cells, to attack the virus as soon as it comes into your body. So that's the whole idea of vaccination. So what it does is it gets your adaptive immunity, the part of your immunity that has to learn a response, and makes it grow and plump up tremendously. So if you get a COVID virus, right? So some of that coronavirus goes in your body into your nasal passage, that your body is ready to fight it very quickly. So echinacea stimulates both innate, it's not going to work like a vaccination, not nearly that strong, not nearly that specific, but I use it for a lot of people who get sick regularly. There's some idea that you can only use echinacea for a short period of time and then it becomes ineffectual. I don't think that's true, but what I do think is true, if you're taking echinacea for a problem for a long period of time and it doesn't help, then maybe it's the wrong herb. So I mostly use echinacea purpurea. I have it mostly in tincture. I have it in glycerite, but I don't think it's that strong. And I think those are the main forms I have it in. I don't think I have any capsules right now. So I usually buy it fresh every year and just make a bunch of tincture. I'm gonna have to try to figure out a way to make a stronger glycerite from it. So that's echinacea. The next herb on the list, take a breath, is yerba santa. So yerba santa is Eriodictyon, Eriodictyon, Eriodictyon. Yerba santa is a West Coast growing herb, and it's used as a decongestant. I happen to be using a lot of yerba santa now because so as we move into cold and flu season, so not only does COVID, which is a coronavirus happening, but the influenza virus is around the corner as well, meaning the flu. And so with it, but especially with coronaviruses, cold viruses, often people are very congested. So one of the herbs I use a lot of is yerba santa. I think I only have it in tincture form, and I use it as a nasal decongestant. It's a pretty simplistic one in this. So the next herb, I saw there's a few questions, but I'm going to keep moving along at this point for a while. So the next one is eyebright. Eyebright is the genus Euphrasia. And eyebright is a little similar to ragweed. Remember I talked about ragweed, Ambrosia artemisiaefolia. Ragweed is Ambrosia artemisiaefolia. Back to eyebright, which is Euphrasia, is another antihistamine-like herb. So I use eyebright predominantly for histamine allergies. Again, those allergies that tend to affect your face, your eyes, your nose. You get a whole bunch of histamine release. You also might get a little bit swollen. So eyebright, I sometimes use more. When I tell people I want to give them ragweed, they freak out because they have allergies to ragweed. It's understandable. But eyebright just has a very cheery name. So sometimes I just move to giving eyebright, but I give it for allergies. At this point, I only have it in tincture form. So, because I gather it. Where I used to gather it from, where I gather it from now, it's actually become very weedy. It's been great. I'm actually starting to over gather it. It's one of those things where, you can never get enough. Now there's lots of it, and I hoard it. So I don't like what my body does with sugar. So the next plant is a little less known. The next plant is silk tassel. So those two words together, the word silk and the word tassel. The genus of the plant is Garrya, Garrya. So silk tassel is a plant that grows more in the west of the United States, and it's one of the best antispasmodics. Antispasmodics means it reduces spasms. Another word for spasms are cramps. So I use it for a wide variety of cramps. So digestive cramps, I use it. So I want to say that when I put out a new plant and you have cramps, you're thinking, oh, this might work. It might. It might be one of herbs, it might not. But I also just want to give the idea at any point that, like, here's an herb, now you're cured. Like, human health is much more precarious and unstable in many ways than that. So silk tassel, I give for folks for menstrual cramps, digestive cramps, and passing stones cramps. So they are very painful. They're still very painful. But you can use that as part of a remedy if people are passing stones. So I mean, both either kidney stones or gallbladder stones, both are extremely different organs. But the passing stones hurts on both of them because you're trying to squeeze something out of a small tube. You're trying to squeeze a hard, slightly sharp object out of a small tube. So basically, as it's scratching its way down, it's just really painful. So silk tassel for that, silk tassel for menses cramps, silk tassel for digestive cramps. It's not very common, unfortunately. I go and gather it myself every few years. Right now, I have enough for a little while. But if you're a crampy person, you might want to look into it. One of my main teachers was Michael Moore. Michael Moore was an herbalist in Albuquerque, New Mexico. He lived many places. I studied with him in Albuquerque. But you can read, I suggest, unfortunately, he died about 10 years ago. but he still has some really great books. I like him. He's sarcastic and has a great sense of humor and is very practical in his application. Most of the plants that he uses are Southwestern plants. I taught botany for him. I'm very proud of that. Also, I studied with him for a couple of years, for 2 years in the mid-90s. So he taught me that, but that's what I use. So Garia is one of the stronger antispasmodics. Garia is silk tassel. The next herb is licorice. So licorice, there's 2 species that I use. I'm just going to name them. Is Glycyrrhiza glabra and Glycyrrhiza urolensis. Glycyrrhiza glabra and Glycyrrhiza urolensis. I don't know if you read how. So I laugh a lot. I have an ironic laugh. Like I'm just about to talk about this horrible thing that happened. And before I did it, I laughed. And I don't know what I'm going to do about this, because in order to get through life as a human being with other human beings around me, I find that irony is the way that I can move forward. And so there's often like this quick laugh that comes out. So I'm hoping that at no point do I seem disrespectful with this laugh. It's just that the story I'm about to say just quirks up my irony, does it? And so probably many of you read, I think it was just 2 weeks ago, that somebody died eating lots of licorice candy. So licorice, and it looks like it was the licorice. So that's uncommon. He was eating a bag and a half of licorice candy for, I think, 2 weeks. I forget the amount of time. You can read the literature about it. So that's still dying from it. So he had hypokalemia, his potassium levels dropped and his blood pressure went up. So this does happen with really large amounts of licorice, usually more than the amount he had. But I would want to say that licorice is a plant that if you have high blood pressure, I would just suggest not taking until you work with an herbalist that's knowledgeable, until you, here's your agency, figure out how it might affect you. Because basically, it works on specialized enzymes in the kidneys associated with aldosterone. So licorice has side effects. You can buy the licorice without the thing that does that. It's called glycyrrhizine. And so there's something called DGL, deglycerinated licorice, but I don't use it. If I just don't want to play around with the plant without the glycyrrhizine in it. So I just choose another plant. So why bother using it? Because licorice does a lot of things. So the first thing that it can do is modify, modify the flavor of medicines. So many people, there's an ironic laugh, many people hate licorice. Licorice haters love to hate licorice, right? So I'll say, do you like licorice? Like, I hate licorice. So don't take it. So avoid, I always ask people, because people who really dislike licorice will never take the medicine with the licorice in it. So that's number one. Number two is if the person has high blood pressure, considering the circumstances, also I might not use licorice. That said, why then use it? So first, for many people like the flavor of licorice. Two, it's demulcent. So there's a new term for today. Demulcent means it has a consistency kind of like honey or mucus or oatmeal. The consistency of it is slimy. That slimy consistency sometimes relaxes the mucous membranes in the body. So for instance, this is something I would use for anybody who has a lot of smoke inhalation that might have particulate matter in their bronchi. And so when you have particulate matter stuck in your bronchi, you're breathing in smoke basically. If you can increase the mucus content in your bronchi, in your lungs, you can bring stuff out better. Also, if you have inflammation of your digestive tract, putting licorice in, I'll describe the different ways that you can use licorice. It's also helpful. You're just basically putting in a soothing mucosal layer. You're putting a soothing mucus-like consistency in there. So it can be very helpful. So anywhere where you have mucosal lining, genitourinary tract, respiratory tract, digestive tract, and then you have irritated linings for any of those things. Licorice, as well as other demulcent herbs such as slippery elm, hopefully just get it from ethical sources, or marshmallow root, could be helpful by increasing the mucus content in other mucosal layers in the body. So number one, demulcent, so helpful for the respiratory tract, digestive tract, and urinary tract by helping increase quality mucus in those places. Number two, it's anti-inflammatory, and it's one of the stronger, broad-based anti-inflammatory herbs that we have. So I use it regularly for all kinds of inflammation. So I tend to acutely, I might use another herb like arnica, which I haven't covered because I don't use it much in the clinic. I don't see much acute illness in the clinic. I see chronic illness. But then with long-term health issues, often I'll use licorice as an anti-inflammatory. So somebody hurt their knee or their elbow, and they're having chronic inflammation. Now, I might use it with arthritis, but there are other herbs that I'm going to also use with arthritis that are kind of more specific for the way that arthritis is formed by the molecules in our body, by the chemicals in our body. So I'll talk less ambiguous about arthritis at another time. So licorice, though, is anti-inflammatory, so it might help a little bit, but often I'm using it more because you injured yourself and you have inflammation. You injured your neck, you injured your back, you injured your knees. And so when you just have chronic inflammation without high blood pressure and you don't mind the flavor, I use it very regularly for that. So I use a lot of licorice. I do find it very helpful. Again, as an emulsant and as an anti-inflammatory are two of the main ways that I use it. The next herb. So I want to just point out we have about 15 minutes. I'm going to stop at 8 o'clock, and then I'm just going to finish up the rest of this at another time. I'm not going to rush through. I don't know. I'll try to answer a few questions in the last few minutes of the class, but I'll just continue at this pace. The next plant is devil's claw. There's lots of devil plants. This is devil's claw. It grows, I forget which country in Africa. It grows in the desert there. And so the reason I point that out is that I worry about over-harvesting plants in places. And so it's hard to know. There's actually I've got to talk to somebody about it. Anyway, that's a whole other wildcrafting ethical consideration making about devil's claw. That's always true. I mean, it could be hard to know the quality and the correct genus and species of plants from anywhere in the world. So devil's claw is the root of the plant. Mainly I use it in both capsule form and tincture form. Those are the only two forms I've used it. And the reason I use it, it's one of the best anti-arthritic plants. It seems specifically anti-inflammatory for joints and even occasionally helps rheumatoid arthritis. Rheumatoid arthritis is an autoimmune form of arthritis, as opposed to like what I would just call generalized arthritis. You just use your joints a lot, and over the course of time, they get creaky and painful. So it's good for that. Occasionally, I have seen it helpful for RA, which is much harder to treat because your white blood cells are attacking your joints. But to sum it up again, devil's claw is probably Harpagophytum procumbens is probably one of my favorite anti-arthritic plants. With anybody presenting with almost any form of arthritis, which means inflammation of the joints, it's one of the plants I could suggest. Really, I think the capsule works better, but I often run out of it, and then it's easier to get the roots and make my own tincture, and then I give that as well. I might use it with licorice as another anti-inflammatory, but the Harpagophytum, the devil's claw, is more specific for joints, for arthritis and inflammation there. All right. Next herb, we're up to letter H. We're getting there about halfway through the herbs. The next one is hops, Humulus lupulus. Humulus lupulus. Hops. Hops I use in quite a variety of different forms, internally and externally. Internally, I use it in tincture and glycerin. Externally, I use it in oil and liniment. So some of the main ways to use hops is for pain, as a sleep aid, and for anxiety. So I haven't really covered many anxiety herbs yet, but hops is a sedative anxiolytic. So sedative means it decreases cognitive function, increases your ability to think as well by a little bit, depending how much you take it and how sensitive you are to hops. So mostly I use it internally, again, as tincture and glycerite. And I use hops a lot to help people for people who have difficulty sleeping, especially if their body hurts when they lay down to go to sleep. So you can use it for an overactive mind as well. So, because hops is a sedative, right? So if you take enough hops, you decrease like all the thinking that's going in on your brain, which for some people can be very helpful with sleep. But also if you have pain in your body, because hops just reduces your feeling of sensation. How to say this? When you take hops, you sometimes feel less pain, right? So it's not as strong as many shots of bourbon or something like that. But it's a lot safer than many shots of bourbon as far as reducing mental acuity and also reducing pain. I feel like I'm not covering this well. Let me say it again. Hops is one of my favorite plants to help people sleep. It's one of my favorite plants in low doses to help with anxiety. It's one of my favorite plants to use for pain. I use it with different plants in combinations, often to get different effects. For instance, if somebody had a lot of spastic pain, they had really bad digestive cramps, I might use it with silk tassel, the antispasmodic. So now you're doubling the effects. You're having a pain reliever and an antispasmodic together. If the person's having difficulty sleeping, I might use it with another herb that's helpful for people who have difficulty sleeping, and that's valerian. So it just kind of depends on the situation. But hops is a plant I've come to rely on a lot in the past 10 years. Once I started using it, I've kind of no going back. And it's the nice thing, it's really easy to get quality hops because it's sold for beer makers as well. So lots and lots of quality hops is sold in the United States for different uses, well, for beer making and as herbal medicine. And usually I can grow enough here. I'm not much of a gardener, but I have one big vine. And usually I get enough to last me the year, making all the different preparations that I mentioned. Tinctures, glycerites, liniments, and oils. So basically pain, sleep, and anxiety. One thing you can do with hops is you can put in a formula to help with anxiety during the day that's not sedative. In other words, a small amount in a daytime preparation that the person can take regularly for anxiety, and then at night have a separate bottle to take a lot more to help you sleep and to help with anxiety when you're not around people and don't need to be well functioning. So that is hops. I'm going to cover one more plant, and then I'm going to look at the questions, and then we'll see what goes on from there. So the next herb is a very tricky one because it does many things. I'm just going to describe a few of its uses. And that plant is Lobelia inflata. So commonly people call it lobelia. It has other names like pukeweed, but who wants to use the name pukeweed? You don't get a lot of patient compliance with the name pukeweed. So I call it lobelia. Most people call it lobelia, but it's Lobelia inflata. There's many lobelia species. Lobelia is a genus. And this is a plant also I rely on very heavily because it does a number of different things. So lobelia, I use it in vinegar form and tincture form. And I think that's the only two ways that I've used it. I've made a glycerite, but I haven't tried it yet. For the past 2 years, I've made lots more glycerins, and I still have to try them. So the main way I'm going to cover now, I'm probably going to come back to lobelia next time because I want to see what the questions that have been written. The main way that I use lobelia is for bronchodilator for asthma. So I do this more in first aid, or I give it to people so they have it on them. So what does that mean? That means that you have asthma and your bronchi are closed off. Either they're constricted or they have mucus in them, or inflammation, or all three. And so you have asthma and you're having difficulty breathing. Lobelia, depending on the severity of the asthma, meaning it's not too severe, will often help people breathe by increasing bronchodilation, by getting the bronchi a little more open. In this way, it works a bit like albuterol, the emergency inhaler that people use. It doesn't work like steroids for asthma. It works like albuterol in the sense of relaxing the musculature of the bronchi to increase breathing. It doesn't reduce inflammation, and it doesn't reduce mucus very much. So, so people with asthma, we give it to them in a bottle for them to take as they need it later with them. Because often, to see the herbalist at the clinic, you need to make an appointment. So often they're not coming in having an asthmatic attack. So, and then people often use it with their albuterol, like they'll take a dropper of lobelia, usually about 10 drops. So lobelia has this whole reputation about being very dangerous. I've never seen anybody vomit. I've given gallons of this stuff. I have heard credible sources of people vomiting. Vomiting is not fun, but also not particularly dangerous. And so I feel like it's a reasonably safe plant for that. Usually I don't give it to very young children, but for like, I don't know, 6 years and above, it's just dose dependent. It is strong tasting and it's definitely acrid, which is probably what makes people vomit. If you open your mouth up and take it and it hits the back of your throat, it'll irritate the back of your throat. It is an acrid, meaning kind of an acidic feeling taking it. So that's one way that I use lobelia. So I use it for bronchodilation, opening up the bronchi in asthma. And also it tends to increase the effectiveness of other nervine plants. So if I'm giving somebody a formula for anxiety and I'm giving them some hops, passion flower, damiana, and rose, I might add a small amount of lobelia because my experience is that lobelia increases the efficiency of other kind of mental health, anxiety, depression, herbs and cognitive function herbs, but more anxiety and depression. And so I put it in formulas very regularly. I think it has an effect on mental health itself, though meaning that it seems like it has some anxiety reducing properties, but I find that I don't really ever use it that way directly. I use it more with the other herbs to increase their effectiveness. So I use a lot of lobelia because I use it in formulas like that formula I mentioned, again, like something like damiana, rose, tulsi, valerian for anxiety, and maybe a fifth part of that or a sixth part of that formula might be lobelia to increase the efficiency of those for reducing anxiety. What I'm going to do now is I'm going to read some of the questions and then take it from there. So let's see what we can get about here. So I think Judy's probably mentioning about some echinacea and autoimmune disease. I think some people respond. So it says, what about autoimmune issues? And that's about echinacea. I have met people where echinacea does increase their autoimmune. They have autoimmune flare-ups. So they're lupus. They're also getting redder in the face or some other part of lupus is flaring up. It seems uncommon, but it seems like it happens. So it's not rare. So anybody who has an autoimmune condition should be considerate, concerned, should be cautious, all those C words, with taking echinacea. Because many people I just work with many people who have autoimmune conditions and take echinacea and don't have a problem, but some people do. So it is wise to be concerned about taking echinacea if you have an autoimmune condition. And that goes with Jill's question. That's my main contraindication for echinacea. And Carmen says, what about anise seeds? In general, people respond the same to anise as to licorice. They dislike both or like both. My experience is that people have the same reactions to both of those, flavor-wise. Robin asks, is it safe to use devil's claw with rheumatoid arthritis if they're already on pharmaceutical meds? So in general, if they go on some of those newer RA drugs that you see advertised on TV very regularly now, I haven't given people devil's claw with people on those drugs. So some of the old school anti-inflammatories I have, and that seems reasonable. With the newer MAB drugs or the biologic drugs, that when I say MAB drug, I mean the drug ends with MAB, and they're what's called a biological drug or a DMD, disease modifying drug. I don't know, Robin. I'm not sure what I would do. Hopefully the drug is working enough, the pharmaceutical, that they don't need to take the devil's claw. Taylor asks, I have a friend with an autoimmune disease called scleroderma. Sorry. One thing I can't do, Taylor, is really respond to a direct question like that, like treating somebody, because it's too complicated. It feels odd for me to do it. It feels uncomfortable. So I'm going to go over that. Yes. And so Lori said, thank you very much, Lori. MAB stands for monoclonal antibody. Thank you for that. And folks, that about winds it up for today. I hope that this was useful. If you're watching it now, thank you, the participants. It's really nice to have some people that I feel like I'm talking to live. And I'll continue this at a later time, and I'll just post this. Michelle, thank you, Michelle, as always. Michelle will post this, and after it gets after Michelle posts it on YouTube, I'll then make a link to it and put it on Facebook and Instagram. And also I send it, I have a newsletter that I send out that's mostly just been talking about events that I do recently, but I have a MailChimp. I have a newsletter. If you go to my website, when you first open the homepage, you have an option for that. Just to point out for folks who are watching it now or for some other time, Michelle and I are going to work on a donation page. You definitely do not have to pay anything for anything that I'm doing here. If you have the resources, it's not set up yet. Michelle and I are going to be working on a donation page for people to help me give more medicines to people, not to see more people, but to give more medicines at the Ithaca Free Clinic. I will also be writing that after we set that up. I'm kind of resistant because I don't want to reach into people's pockets because already many people's pockets are tattered and torn. But that would be an option. So thank you everybody who's been here. I hope this has been instruction, maybe even a little bit of fun. And thank you very much. Bye now.